Health Organization, Dr. Tedros Adhanom Ghebreyesus. I think, as all of you know, he is from Ethiopia. He is the first African to hold the post of Director General of the World Health Organization. He's a legendary infectious disease specialist, and he's had a lot of experience in public service. He was Health Minister of Ethiopia, and he was Foreign Minister of Ethiopia. He's joined today by two of his colleagues, Dr. Mike Ryan of Ireland, who has done extraordinary work since 1996 on global health, including during the SARS and Ebola epidemics, and including in the campaign to eradicate polio. We're also joined by Dr. Maria Van Kerkhove of the Institut Pasteur in France. She's an infectious disease specialist working now with the World Health Organization. I'm really pleased to also introduce our moderator, one of America's most distinguished journalists, and that's Lester Holt, who's the host of NBC Nightly News. I'll turn this over to Lester in just a moment. NBC is our strategic partner. We're very grateful, Lester, for your partnership and that of all your colleagues at NBC. When the questioning starts, Lester's going to call first on Mayor Keisha Bottoms of Atlanta, Georgia. She'll ask the first question, and we'll take as many questions as we can. Dr. Tedros, I know you have an opening statement. I just wanted to say this. As an American, I thought it was a great mistake for our government to announce its departure from the World Health Organization and then to withdraw its funding. And a lot of Americans agree with me that during a great global pandemic, we should be pitching in and helping the rest of the world, not taking our funds and leaving. I also hope, and I think a lot of people hope, that the World Health Organization can reform itself, can account for its deficiencies. But most of all, I wanted to say, because we are all in the middle of a global pandemic, we wish you well. We thank you for what you're doing. We thank you for being with the Aspen Strategy Group this morning, this afternoon, where you are. So please, Dr. Tedros, please take the floor.
Yeah, thank you. Thank you so much for that very kind introduction. And thank you also for this opportunity. It's a great opportunity for us, to have this, opportunity from Aspen Security Forum, but also an NBC. So I will go straight to my statement, and then we will also receive questions with Mike Ryan, my general, and also Maria Van Kerkhove. By the way, to just correct, Maria Van Kerkhove is our senior lead on COVID, and she's from the US. Just wanted to correct that. And I want to extend my sincerest thanks to Aspen again and NBC for inviting Dr. Mike Ryan, Dr. Maria Van Kerkhove, and I to speak with you today. The events of the last 7 months are a tragic reminder of the insecurity and instability that disease can cause. The COVID-19 pandemic has changed our world. It has stress-tested our political, economic, cultural, and social infrastructure and found us wanting. It has pushed the limits of health systems, both weak and strong, leaving no country untouched. It has humbled us all. The world spends billions every year preparing for potential terrorist attacks, but we have learned lessons the hard way that unless we invest in pandemic preparedness and the climate crisis, we leave ourselves open to enormous harm. Since WHO was created over 7 decades ago, we have worked to galvanize collective international public health action to build a healthier and safer future for humanity, from ending smallpox to bringing polio to the brink of eradication, from rolling out treatment for HIV, TB, and malaria to millions of people across the world, to responding to hundreds of emergencies. Building up all health systems and ensuring health for all is our best shot at delivering on the goal of the global health security. 15 years ago, the global community came together and adopted the international health regulations in 2005. Its implementation by 196 state parties was a major step in the coordination of international action to enhance global health security. Following WHO being notified of an atypical strain of pneumonia circulating in Wuhan province, China, the IHR, the International Health Regulation, was triggered, and the world was subsequently informed of the outbreak in early January. The genome was mapped within the first week of January, and in the second week of January, it was publicly shared, and WHO published how to build a PCR test for COVID-19 from our partner lab in Germany. In the third week, WHO identified and began contracting for validated production of quality PCR tests. And by the first week of February, WHO began shipping tests to over 150 labs around the world, which enabled the world to track and trace the virus around the world quickly. And it was under the IHR, the International Health Regulation, that WHO declared a public health emergency of international concern on 30th January, WHO's highest health security alert under international law. At that time, there were fewer than 100 cases and no deaths outside of China. Today, more than 18.5 million cases of COVID-19 have been reported to WHO, and 700,000 lives have been lost. No country has been spared. Low, middle, and high-income countries have all been hit hard. The Americas remain the current epicenter of the virus and have been particularly hit hard. Just 3 countries have reported over half of all cases. No single country can fight this virus alone. Its existence anywhere puts lives and livelihoods at risk everywhere. It's never too late to turn outbreaks around, and many countries have done just that. So it's never too late to turn the situation around. Our best way forward is to stick with science, solutions, and solidarity, and together we can overcome this pandemic. COVID-19 has also exposed how misinformation poses one of the greatest security threats of our time. Misinformation can spread faster than the virus itself. Since the beginning of this pandemic, WHO has been working to address misinformation. We have worked with all major tech companies to counter myths and rumors with reliable evidence-based advice. Last month, WHO brought experts together from across the world to hold the first conference on how best to tackle the COVID-19 infodemic. Through our daily situation reports and regular media engagements, WHO officers have kept the world informed. Myself, Maria, and Mike have ourselves done more than 90 press briefings. We have, on a weekly basis, briefed our member states to present the latest scientific knowledge, answer their questions, and to share and learn from their experiences with COVID-19. WHO will continue to support everyone, everywhere, and work with leaders, communities, and individuals to foster global solidarity, suppress the virus, and save lives and livelihoods. Even as we fight this pandemic, we just ended the second largest and probably the most difficult and complicated Ebola outbreak in history in the Democratic Republic of the Congo. We have applied lessons from previous outbreaks and innovations developed and researched ethically in conflict situations to bring the deadly disease under control. And just this week, our team in Lebanon is responding to the large explosion that has killed more than 130 people and injured at least 5,000. Whether it's COVID-19, disease outbreaks, or responding to humanitarian and natural diseases, all are intrinsically linked to global health security. While health has often been viewed as a cost, the first coronavirus pandemic in history has shown how critical health investment is to national security. And universal health coverage is essential to our collective global health security. Building back stronger health systems will require political will, resources, and technical expertise in high and low-income countries alike. That's why WHO's highest priority is to support all countries to strengthen their health system so that everyone, everywhere, can access quality health services when they need them. COVID-19 has already taken away so much. We must seize this moment to come together in national unity and global solidarity to control COVID-19, address antimicrobial resistance, and the climate crisis. For all our differences, we're one human race, sharing the same planet, and our security is interdependent. No country will be safe until we are all safe. I urge all leaders to choose the path of cooperation and act now to end this pandemic. It's not just the smart choice, it's the right choice, and it's the only choice we have. I thank you. Thank you so much again.
And I guess this is where I began. Let me first of all extend my thanks on behalf of my colleagues at NBC News. We're very pleased again to be a participant in Aspen. This is obviously the topic one of a story we cover every night. I want to thank Dr. Tedros, Dr. Ryan, Dr. Kent Vanderkerkhove for taking part of this conversation. Before I get into my questioning, I just want to let folks know that if you want to be a part of the question and answer session in just a few minutes, raise your hands here virtually, and as was noted, we will get to as many as possible. But Dr. Tedros, if I could begin with you, I want to pick up on something you said the other day that I think was a gut punch to a lot of us. It was the idea that there's no silver bullet here. If there's not a silver bullet, can you help us manage our expectations? What's the next best thing?
Thank you. Thank you so much. Thank you actually for starting our discussion with that question. When I said no silver bullet, I also said no silver bullet right now. And the reason is, as you know, we have been working on vaccines, therapeutics, and diagnostics since we had our first meeting with scientists all over the world in February. And of course, we have more than 200 vaccine candidates, and 6 of them are actually at a very good stage, clinical trials. So there is hope, but at the same time, without knowing the result of the clinical trials, we cannot say that we have vaccines. We may or may not. So the reason I said what I said is people were, of course, being hopeful about vaccines is good, but many were not doing or using the tools we have at hand now. As you know, governments should do testing, should do contact tracing, should do isolating, and also quarantining. At the same time, communities, all citizens should do what is expected from them. That's physical distancing, hand hygiene, wearing a mask, and so on. If we can use all these tools, we can suppress and control this pandemic. Many countries have shown. So my message was, let's do what we can do today to save lives. The tools at hand can help us to suppress the virus, while investing in vaccines, which we may have vaccines or not, but while investing on vaccines, therapeutics, and the rest. So it's just to keep the balance. We need to use the tools at hand now to the maximum, but at the same time invest in vaccines.
I want to explore vaccines a little farther. We've seen a lot of inequalities in our world magnified through this crisis. When a safe and effective vaccine is produced, who's at the front of the line to receive it and who's at the back of the line, and what role does WHO have in determining that?
Yeah, I will start on that, and my colleagues will add. As you know, we launched the ACT Accelerator initiative end of April, WHO and partners. And we had 2 objectives. 1, to speed up development of a vaccine. 2, to ensure fair distribution so that people who may not have access can have access. Because of financial problems, they may not have access. These two objectives are very, very important. But to make it happen, especially the fair distribution, there should be a global consensus to make a vaccine, any product, a global public product. And this is a political choice, a political commitment. And we want political leaders to decide on this. Vaccine nationalism is not good. It will not help us. When we say it should be a global public good, it's not sharing for the sake of sharing. It's only because it has advantages. For the world to recover faster, it has to recover together. Because it's a globalized world. The economy is intertwined. Part of the world or few countries cannot be a safe haven and recover. They should recover together with the rest of the world. So what we're saying is sharing vaccines or sharing other tools actually helps the global world, the world to recover together, and the economic recovery can be faster, and the damage from COVID-19 could be less. So when those countries who have the means, who have the funding, commit to this, they're not giving charity to others. They're doing it for themselves. Because when the rest of the world recovers and opens up, they also benefit. So that's why we're saying we should have a vaccine which is considered as a global public good that can help us to open up the world and speed up the economic recovery, which is hurting many countries. And it's not a charity. And that's how it should be seen. And I hope that many countries now taking that understanding and joining, and we need to make progress though, more progress, and there should be a political commitment.
Russia has recently announced that they're targeting October for mass inoculations after apparently cutting short the trial period. What is your level of concern about any vaccine candidate that hits the market in this calendar year? Should we be worried?
Maybe I can step in there. This is Mike Ryan. No, I think what we have to be focused on is, yes, accelerating the development of the vaccine. And a lot of people in the US and in many countries around the world are doing tremendous scientific work to accelerate the development of the vaccine. And I think with over nearly 140 vaccines at some stage of development, 26 in clinical trials and 6 in phase 3 trials, that's an incredible outcome for a very few short months of work. What we need to do now is ensure that that vaccine is safe and efficacious. The studies are underway, 6 phase 3 trials, beginning with larger numbers of patients. And as that work continues, we have to continue to watch out for the safety and for the clinical efficacy signals. Should we find that signal, we should be able to move into production of that vaccine and begin to use it in human populations. But we will still have to remain cautious as we scale up the number of people vaccinated. Rare side effects are rare, and they only become apparent when you vaccinate lots and lots of people. So there will still be a need for a monitoring phase, even when we start to vaccinate at population level. There are no cutting corners here. I think many experts in the States, the head of NIH, Tony Fauci, and others have spoken. This is about accelerating the process of development, putting the risk in financial side of the equation, not on the safety side of the equation, and ensuring that there's enough production to meet the needs around the world. And that is the key issue. Are we going to have enough vaccine for everybody who needs that vaccine around the world?
I'm curious to get your thoughts about this notion of human challenge, of purposely exposing people in the trial to the active virus, the ethical concerns about that. What are your thoughts, Dr. Tedros?
I can begin. Tedros can follow up. The human challenge, we've had a group looking at human challenge studies. Certainly, for those of you out there who don't know these things, this is where you would potentially intentionally expose a person who's been vaccinated to the virus in order to see if the vaccine works. On the face of it, one would never attempt that with an extremely dangerous virus. In this case, young healthy adults don't tend to get very sick, and there could be a justification for that in certain circumstances. This is usually done when there's very low level of human disease, and therefore it's difficult to demonstrate efficacy. In this case, we have disease all over the world. We should be able to demonstrate efficacy of the vaccine in the traditional way by large-scale population-based trials. But we've had a committee looking at this. We have laid out the parameters for when and where and how this could be done. Obviously, we do not fully understand the long-term consequences of natural infection, even in younger adults, and we will have to think and be very, very careful before instituting human challenge studies. They will have to be very carefully assessed for their ethics and the potential health effects. But there are circumstances, certainly, in which such trials can be justified with the appropriate ethical oversight.
All right, I want to ask about schools. UN Secretary General Antonio Guterres has warned of a generation of catastrophe because of school closures during the pandemic. It's obviously something we're wrestling with here in the United States, but globally, it's a huge question. Doctor, could you offer what the WHO guidance is on school reopenings, what works, what doesn't work, and what the level of risk we should be willing to accept?
So thank you for that question. It's a really important one all across the world. We have laid out some guidance on the considerations for when schools should be closed or when schools can be opened. I think what we need to think about are a couple of things. One is, what is the risk of this infection in children? What do we know about that in terms of the virus's ability to infect children? We know children can be infected. What is the disease that is caused in children? And we know for the most part, luckily, most children who are infected will have a mild disease and recover just fine, but that is not universal. We do know that there are some children that could develop severe disease, and some children, unfortunately, have died. And we do know that children can transmit this virus. We're still learning about this. We're still learning the extent of transmission among children of different age groups. And so that is a large unknown that we have right now. Some countries never closed their schools. Some countries have and are now opening up their schools. We are seeing some transmission that is happening in schools, and we're learning about this. What we've done is we've tried to offer some considerations for those taking decisions about when schools can be open. You have to remember that schools aren't in isolation. Schools are within communities. And if the virus is transmitting in the community, then the virus can transmit in that school. It's not only the children that we are concerned about, it's the people who work at those schools. So if the virus is present in the community, we need to really focus on driving down transmission in the community to think about opening up the schools. We also need to consider how these schools are run in terms of the number of children per class, and if there are physical distancing that can take place, if there's hand hygiene available and running water and being able to wash hands. We need to look at the control measures that are in place that can be put in place in schools, and the ability of those schools to rapidly be able to detect cases. But it's something that we're still learning about. And we need to make sure, I think the big thing is that if the virus is circulating in the communities, those schools are part of that community. And that means that the virus can enter the school as well. But we're still learning quite a lot about this. So we've outlined considerations. We've published those guidelines. We have established a technical advisory group that's working with us to look at educational institutions across the globe, because many schools look differently and operate differently across the globe, to look at our guidance and to look at the experiences of countries to see how we can further support decision makers in taking decisions about schools.
And Dr. Van Kerkhove, while I have you, let me ask you about the notion of further lockdowns, of border restrictions. Are we seeing any of those being effective, and that it might be necessary in some cases to impose more?
So that's a good question as well. I think when people use the word lockdown, that means different things to different groups. Many people we don't actually use that word lockdown because it's actually composed of several different types of interventions that are used. There are restrictions, stay-at-home restrictions that some countries have used. There are movement restrictions that some countries have used, physical distancing, hand hygiene, the whole package. And I think what the Director General has said and what we've tried to say from the beginning is that it isn't one action. It's actions of individuals, it's actions of communities, and we do see that these measures work. What we are seeing is that what we're hopeful for is that we will not have to, or countries will not have to impose any of these so-called large lockdown measures again. That actions can be tailored and they can be geographically limited to where you have the most intense transmission. They can be time limited to help countries activate their public health systems to find cases, isolate cases, care for cases, carry out contact tracing, make sure that testing is available, and make sure that communities are engaged, empowered, listened to, and are part of this fight.
Dr. Tedros, in your opening remarks, you mentioned that the Americas seem to be struggling the most right now, although obviously the entire world is affected. Can you offer your opinion as to why the Americas are having such a difficult time?
Okay. So my colleague who will take this.
First of all, let us take our hat off to all the frontline public workers, frontline workers in the United States and all over the world who've worked so hard and risked their lives, left their families to look after, to save lives, to stop transmission. We are all in this together, and there are heroes at every corner of this, of the United States and around the world. Every country at this point has struggled at different parts and different stages in this pandemic response. No one has had all the right answers, and no one has done all the right things every time. This is a new virus evolving quickly. There are lots of unknowns. And referring maybe back to Maria's previous answer, I think the lockdown issue is a hugely blunt instrument. It's a very blunt measure. It suppresses the virus by really separating everybody from everybody else. And that's been the struggle. Can we move away from such a blunt measure to a more sophisticated, real-time, localized, targeted, comprehensive strategy based on local data, local action, a rapid turnaround of testing, the ability to isolate and treat cases quickly, the ability to identify, track, trace, and quarantine contacts. In other words, if we are to get out of this, and I would say this to the United States, as I would say to many other countries, we have to create a new partnership, a new deal between government services and community action. Communities, individuals have to be empowered, educated. They have to want to participate. They have to take most of the actions needed in terms of physical distancing, wearing masks, hand hygiene, avoiding crowded places. But they need to be facilitated and supported in that if they have to go into quarantine, if they have to be isolated. And the local authorities need the data. They need the rapid turnaround of testing. They need to be able to do case finding, contact tracing. We need a massive ramp up of the public health workforce in order to do that. This has to be a major push, and we all have to take a breath now. We all have to stand back. And it's very easy to look from one side of this house to the other, one side of this world to the other, and point at what everyone else is not doing right. What we all need to do collectively, we need to take a step back. We need to look at the problem again, and we need to go at the problem again. And that needs everybody on board. It means bipartisan, all of government, all states, all communities working together. And that requires strong, sustained, and trusted leadership at all levels to make that happen. This is not easy. It's easy to say. It's not easy to deliver. We have the tools to suppress and bring this disease under control, and we hope we will have the tools to eliminate this disease as a public health threat when vaccines come along. In the meantime, as the DG said, and has said again and again, do it all.
A question about the U.S. withdrawal from the WHO. As you know, it doesn't really become effective officially for almost another year or so. In the interim, can you tell me if the United States is actively participating in partnershiping with the WHO and other nations during this withdrawal period?
Yeah, thank you. First of all, I mean, with regard to the withdrawal, this is, to be honest, we have been working with the U.S. very, very closely. And U.S. is known for its generosity and support and also leadership in global health. And its leadership and support has really saved many, many lives. When I was a minister in Ethiopia, when actually HIV/AIDS was ravaging the whole continent of Africa, and of course in the rest of the world too, it's the U.S. generosity and leadership that gave hope to individuals, gave hope to families, and gave hope to nations. I remember how the advent of PEPFAR and also Global Fund, which was established with a significant contribution from the U.S., saving lives and turned the tide. So that's what we remember whenever we think about the U.S. So we appreciate that. We appreciate the generosity and leadership of the U.S. Then now, when the U.S. decided to withdraw, the problem is not about the money. It's not the financing issue. It's actually the relationship with the U.S. which is more important, and its leadership role. I said it many times, you cannot defeat this dangerous enemy in a divided world. We need a united world, and a united world needs cooperation and solidarity among its major powers. Multilateral organizations can only support, like WHO. The leaders always have been countries, and especially the major ones, who can bring the whole world together. So that is more important for WHO. The void, not the financial. And we hope the US will reconsider its position. If there are issues about WHO or the UN system at large, we're very open for any evaluation or assessment, and the truth can be known, and this can be done from inside without leaving the organization. And knowing the truth is very important for the whole world. We're in a very unprecedented situation. The pandemic has turned around the whole world. This minute or invisible virus has taken the world hostage. So we need to learn lessons from what happened and what's happening. And we need to build the future together. So everybody should be prepared for lessons to be learned, honestly. And nobody is saying anything different from that. So if there is any problem, we will find out and we will learn from it. But now it's time to work together. Now it's time to focus on fighting the virus. So I hope the US will reconsider its position. But now, as we speak, we had actually a meeting today, and we were briefing the mission, all member states, and the US has been participating actively, and we still have communication. We're working together, and we appreciate that. But I hope the relationship will return to normal and a stronger relationship than ever before. Thank you.
Dr. Tedros, thank you for that. This is a kind of a turning point in our discussion right now. At this point, I'm going to open this up to folks in the audience. We do want to start, though, with Atlanta Mayor Keisha Lance Bottoms, who has experience with this on many different levels, as you know. Mayor, thank you for taking part, and I'll let you ask your question.
Thank you so much, Lester, for recognizing me. I do have a question regarding resources that are available for helping us to accurately track and measure the racial and ethnic disparities with COVID-19. We've seen a significant divide in Atlanta and in Georgia, and of course that's happening across America. And just with the poor way in which we are collecting data, are there any other opportunities for us to use other tools to help us track this information?
So thank you so much for that really critical and important question. Absolutely. I mean, I think there's different ways in which data can be collected to really help us understand the disparities, the inequalities, the risk factors that put individuals and populations at a higher risk of severe disease and or death. And there's ways to do that through surveillance data, through the routine collection of information that we have from people who are detected through routine surveillance systems. We also have the opportunity to do different types of studies. So research studies that either focus on hospitalized patients and looking at people who show up for healthcare, who are detected through healthcare, through other types of investigations and epidemiologic studies that focus on different types of populations to really help us identify the extent of infection among people, which is either measured through these molecular tests or PCR tests or serology, which measures antibodies, and those risk factors of why certain people are getting infected and what are those risk factors that put them at a greater risk. They can also evaluate not only those types of characteristics, but health-seeking behavior, access to healthcare, looking at underlying conditions. I think this is a very complicated story that really needs good information to be able to help us disentangle this. But I think what is most critical for me anyway is that we have to do everything that we can while we're learning. We have to do everything that we can to prevent as many infections as we can. And we do have the tools right now to do that, and we need to be focusing on that. Because not only do we prevent infection from people who may have an asymptomatic infection or a mild infection, we prevent them from passing the virus to somebody who is part of that vulnerable category and could go on to develop severe disease and die. So there's a lot of ways that we can do this through surveillance activities, through routine data collection, but also through specific studies that can happen across many different countries.
All right, Mayor, thank you for your question. Yes, I'm sorry, go ahead.
If I could just briefly supplement, because I think that it's a very important point, and I think there is more research needed in this area. There's lots of anecdotal measurement going on, and it's very important, and it's pointing to some of these deep inequities, be they sociocultural or be they ethnic. But there is no question that these factors are particularly driving negative outcomes amongst many, many groups. And we need to document this much more carefully, much more systematically. And we've been using the Director General created a Solidarity Fund a number of months ago, and we've been trying to use and identify interesting projects that are maybe not subject to the normal mainstream funding. And we will certainly, based on your advice, look more systematically at how we can fund studies around the world on this particular theme. And while I have the floor, Atlanta hosts one of the greatest scientific institutions on this planet, the Center for Disease Control. And as the DG spoke about ongoing work, I would again like to thank the United States for so many decades of service of the Center for Disease Control all around the world. I don't know if Americans realize just how important CDC is, not just to Americans, but to every citizen on this planet. We have worked hand in hand for many years. I have learned at the knee of so many great scientists at CDC. So it's just great to have the Mayor of Atlanta on so we can say thank you for hosting such a wonderful institution, and our regards to all our colleagues and friends over there. The politics of these things will never shake the bonds that scientists have around the world and the urge and the desire we have to work together to save lives.
All right, our next question comes from Bianca Rotier. Okay, maybe we have lost her. The next person we have waiting to ask a question is Antonio Broto.
Can you hear me?
Yes, I hear you. Is this Bianca?
Yes, exactly. Many thanks for taking the question. I'm correspondent in Switzerland for Globo News and for Globo, the largest TV network in Brazil. My question is specifically about indigenous peoples in the Americas and in Brazil. 2 weeks ago, Dr. Tedros said that the WHO is deeply concerned. And yesterday, Brazil's chief Aritana Uwalalapiti, one of the most influential leaders, indigenous leaders, he died from COVID-19. So does the WHO has an idea about the number of cases and deaths between indigenous peoples in Brazil? And could you please give us more details about the challenges faced by indigenous peoples in Brazil and the work done by the authorities? Is it enough? Many thanks.
Yes, we can get you some specific numbers on Brazil. I just don't have them at hand. If you forgive me, we can provide them afterwards. But the point you raise around the effects of this disease in indigenous peoples is real. I think the mayor referred similarly to issues around ethnicity. There are definite ways in which this virus may be differentially affecting certain groups, but it's most certain that the outcomes for these groups are very different. Whether or not ethnicity or your genetic makeup makes you more susceptible to disease is still in question. But what's not in question, I believe, is that if you, because of your ethnicity, because you're an indigenous person, if you are living in poverty, if you've lived for years without access to adequate healthcare, if you've got underlying conditions like diabetes or hypertension because of lifestyle issues that have been induced by poverty and by lifestyle, then the outcomes in this disease are much, much worse. And the access to health services is much slower, much later, and very often not of the same level of sophistication. So there is no question of that. There are maybe two groups of indigenous peoples that we look at. One are groups who are living in their traditional environments, be it in the Amazon rainforest or in other situations. And then there's probably an even greater number of people who come from indigenous backgrounds who live very often in peri-urban, poor situations, and they suffer very much the same diseases and the same vulnerabilities as the urban poor in general. And in many countries, indigenous people make up a disproportionate number of people living in situations of poor access because of poverty, because of lack of access, and frankly, because of racism. So I think the trick here is really creating access for everyone to health services now to save lives, and doing something much more systematic in the long term, which is the greater challenge. And that is, how do we reduce these differences and how do we get rid of the inequities that exist over long periods of time that ultimately result in these poor outcomes when we're hit with diseases like COVID-19.
All right, our next question is Antonio Broto. Antonio, are you there?
Yes, hello.
Yes.
Okay, so I have two questions, but one of them is really short. When you mentioned there is 6 vaccines almost ready, can you tell us which are these candidates? Are the ones from Russia, China, United Kingdom included? And my second question is about Spain. Several countries like United Kingdom and Switzerland are declaring quarantines against travelers that come from my country. Is the situation in Spain worse than in other parts of Europe? Thank you very much.
I'll start with the second part of that question first. So the question you have specifically about certain countries and different measures that are putting into place, I think the way I would like to answer that question is the fact that we have had many countries across the world, and even in Europe, we'll focus on Europe for the moment, that have had success in bringing really terrible outbreaks under control. And I think that is a sign of hope for countries that are really going through something very, very difficult right now, including my home country in the US. But what I want to say about the introduction of new measures again, or the reintroduction of some measures, is I think that all countries need to be in the mindset that we have to be ready, at the ready, to quickly detect cases. So if we can quickly detect cases, we can prevent those from forming clusters, and we can prevent those clusters going into community transmission again. And what we're seeing is a number of countries that are introducing measures in a localized, strategic, and appropriate way so that they can really stamp out some of these fires, these little fires that start before they turn into big flames. And I think that that's something that everybody needs to be prepared for. So even countries that have had success in suppressing transmission, I'm seeing some, articles that will say, well, they were once a sign of hope. I think they are still a sign of hope because many countries have structures in place. They have surveillance in place. They have workforces in place to quickly detect these clusters and bring them under control so they don't move into community transmission. And so we need to apply what we are learning. We need to use the tools that we have so that we don't get into difficult situations again.
And maybe just some more detail on the vaccines side of things. Yes, I did mention that there are 6 candidates currently in phase 3 trials. And I think I said before there was about 140 candidates in some form of trial. I think that's actually up at around 165 at the moment, with still 26 in clinical trials of some type. The 6 candidates that I referred to, 3 are from China. One is the AstraZeneca, University of Oxford. There's the Moderna NIAID vaccine, and then the Pfizer vaccine, BioNTech vaccine. They're the ones that are currently in phase 3. And I think I want just a word of caution. Phase 3 doesn't mean nearly there. Phase 3 means this is the first time that this vaccine has been put into the general population, into otherwise healthy individuals, to see if the vaccine will protect them against natural infection. In fact, it's the beginning. Up to now, all of the studies have been around safety, immunogenicity, and ensuring that the vaccine generates an immune response in a small number of humans and doesn't generate adverse events that would prevent the vaccine moving forward into trials. In that sense, there are sort of gates that the vaccine has to go through. This is not a gate. This is a race for the vaccine now to demonstrate that it can protect large numbers of people over a prolonged period of time. And we would hope that more studies will enter into these trials. The candidates that are in trials, which what is good, some are RNA or nucleic acid vaccines, and 2 are non-replicating viral vector vaccines, and 3 are inactivated viruses. So we've got a good range of products across a number of different platforms, across a number of different countries. That's good, but we're going to have to wait and see what the outcome of these are. There are a large number of other candidates out there, and we are working to see, because there's no guarantee that any of these 6 will give us the answer, and we will need, and probably will need, more than one vaccine to do this job. So we are working with partners all over the world to duplicate. We've been working on the Solidarity drug trials, in which we're doing multiple country trials on drugs. We're also building a platform for Solidarity vaccine trials, which will allow a greater number of potential vaccine candidates to be tested in a larger number of countries. And as I said before, in countries with high incidence, so we possibly can avoid being able to use challenge trials as a way of demonstrating efficacy.
Listen, I thank you all for your answers. Regrettably, our time has expired, but thank you for what you're all doing. We are depending on folks like you. I hate the fact that it could ever be a cliche. We are all in this together, and so we appreciate you spending some time with us today. And I want to thank Aspen again for including me. Thanks, everyone, and good day.
Lester, thank you very much. We're really pleased that you were able to moderate this session. Thanks to NBC News. I thought, just as a citizen listening to this, we all recognize that the World Health Organization needs structural reform. There'll be time to do that, and they've got to do it after the pandemic is over, but we're in the middle of the pandemic. And I thought it was a really interesting session for Americans to listen to see the professionalism of Dr. Ghebreyesus and Dr. Ryan and Dr. Van Kerkhove, an Ethiopian, a citizen of Ireland, a citizen of the United States. They're working as hard as they can for the rest of the world. The WHO is the only institution that can unite us right now in the pandemic. And so for the United States to leave and take its money with it was extraordinarily short-sighted and unwise, a major mistake by our country, in my judgment. We're going to continue this conversation in a slightly different format. We're going to welcome now to the Aspen stage Mayor Keisha Lance Bottoms of Atlanta. Mayor Francis Suarez of Miami, and my friend, former mayor of New Orleans, Mitch Landrieu. The title of our session is On the Front Lines, Race, Pandemic, and the Recession. Our moderator is going to be Kristen Welker of NBC News. As many of you know, this conference has been largely focused on national security for the Aspen Security Forum, but I think a lot of us believe that at this moment, and if I could just ask people to mute if they could, that would be great. Thank you so much. We're largely focused here on national security, but I think at this moment, a lot of us believe that the United States cannot succeed in its foreign and defense policy if it's not united at home and if it's not stable at home. Mitch Landrieu and I are going to write an article together about the deep integration between domestic policy, what's happening in our streets and cities and across the country, and foreign policy. And Kristen, as I turn this over to you, our mayors and our governors are facing four simultaneous crises: the pandemic crisis, the economic crisis, the racial crisis, and certainly a leadership crisis, in my judgment, in Washington, D.C. So that is what's at stake in this panel. Kristen, you're most welcome. We're glad you're here. And I suppose in a minute, our friend Mitch is going to appear, but I'm going to give the microphone over to you right now. Thank you.
Wonderful. Nick, thank you so much. Thank you to Aspen for inviting me to moderate this panel at this critical moment. Can everyone see and hear me? I'm actually at the White House. This is not a green screen.
We can see and hear you.
Okay, good. Wonderful. I want to thank our three mayors for joining us. Two of our mayors obviously on the front lines right now, Mayor Keisha Lance-Bottoms, Mayor Francis Suarez, and former Mayor Mitch Landrieu, no stranger to dealing with crises, obviously serving as Lieutenant Governor during Katrina and then mayor in the years after, and continues to be so active in his community. So we are going to talk about the multiple crises that we are facing right now as a country at the federal, state, and local levels. And Mayor Bottoms, I'd like to start with you because you had a chance to ask a critical question of the World Health Organization, and I think it really helps to set the tone for this conversation. You asked the World Health Organization what resources are available for helping us accurately track and measure the racial and ethnic disparities of COVID-19. What were your key takeaways from the response that you got, Mayor? And I think, Mayor, you're not unmuted. Okay, there you go.
Now I'm unmuted.
Now we can hear you.
Thank you. Welcome to COVID.
Yeah.
So my key takeaway was really to go outside of the normal ways in which we would think to collect data. Quite frankly, I've been stopped at the fact that the state was not collecting data on the front end, but it had not occurred to me to go to other sources such as our hospitals who may collect the same data and give us the same snapshot. Based on what we do know, the African American community in Atlanta in particular is being hit in a very big way, and statewide we're seeing it with our Black and Brown communities. The disparity is alarming, and even when you look at Atlanta with our population just over 500,000, and there is a statewide population of over 10 million, we still account for roughly 45% of the positive COVID cases in the city. And based on the data that we do have, the death rate is somewhere close to 80% or more in the African American community. And so that it's startling, it's alarming, but also highlights the systemic issues that we know are really elevated during this time of COVID.
And race is obviously such a big factor right now in terms of not only battling the COVID crisis, but in terms of what we are seeing nationwide, the protests calling for change. Let's keep the focus for right now on COVID. We are going to get to all of that, but Mayor Suarez, pick up where Mayor Bottoms leaves off, and the fact that you have these communities of color who have been so disproportionately impacted by this virus. How can we better get resources to these communities if we're not accurately counting and assessing how they are being impacted?
You know, in the city of Miami, we're a city that has a tremendous amount of poverty generally. And people see oftentimes the glitz and the glamour of our city, but the city of Miami is a poor city. And, you know, it's incredible when we have a situation, and I'm glad that I'm on with my good friend, Keisha, mayor of Atlanta, because they're slightly above the 500,000 population threshold. I think they're at 506. We're slightly below the 500,000 threshold. We're at 468. So one of the big challenges that we've had is we have not seen a trickle down of CARES Act funding that cities that have a population or counties that have a population of over 500,000 have received. I think Mayor Bottoms may have gotten a direct aid of $88 million. So far, we have $0 right now in our community, which would allow us to feed people in our community. It would allow us to provide help to small businesses. It would allow us to help with rent and mortgage relief, which is so desperately needed in our community, because as was being said by the representative of the World Health Organization, you know, a lot of the problems with outcomes in COVID is, you know, the facts, the circumstances that people are in the current moment, right? If people are not able to take care of themselves, then they are more likely to have some level of pre-existing condition that's exacerbated as they confront COVID, which certainly makes the outcomes much poorer. And we're seeing that across the board. And so the fact that you know, we have not gotten essentially any real aid from the federal government from a COVID perspective, from a CARES Act perspective, is something that I'm hoping that whatever bill passes, hopefully sooner rather than later, not only provides more funding for cities and not just for our deficits, but creates a waterfall effect so that the 500,000 population, which is wonderful for cities like Atlanta that desperately need it, is something that a city like ours, which is slightly below it, doesn't get a guaranteed funding source. So that is something that hopefully will be fixed in the next round of funding, because we desperately need it.
Well, Mayor, just to follow up on that, why did Miami not get the federal funding that it needed from the first round of CARES? And your message to lawmakers. We've spent a lot of time here at the White House covering the negotiations back and forth. They've been going on for days now, still no deal in sight. So the urgency that you are feeling right now in Miami to get federal funds to your city.
The urgency is critical. The reason why we didn't get it is because they put an arbitrary threshold of 500,000 for populations of cities, counties, or states. And we have 468,000 according to the 2019 census. So we basically missed it by 32,000. And it would have been $81 million that would have gone to the city of Miami and would have allowed us, like I said, we had meal programs that we were fronting the money for. We had a rent and mortgage subsidy programs, which of course people cannot pay their rents, people cannot pay their mortgages, because many of them, by the way, have lost their jobs by government mandated shutdowns, which we needed to implement to get the virus under control. So my message to legislators, number one, is we need action immediately. We've signed on over 250 mayors, and a bipartisan coalition of mayors from the U.S. Conference of Mayors have urged the federal government to please pass a relief package immediately and to please fund it as well, not just give flexibility under the first CARES Act. And I think, you know, we certainly also need the flexibility under the first CARES Act, and we also need a waterfall provision so that smaller cities are also receiving help and that are not at the mercy of a county that may want to divvy up the funds for political reasons or for other reasons.
Mayor Landrieu, let me have you jump in on this point. How critical, you are no stranger to dealing with crises that disproportionately impact the African-American communities in your city. So how critical were federal dollars to your city in the rebuilding of Katrina and other crises that have impacted your community there?
Well, thank you for the question, and I'm thrilled to be here with Mayor Bottoms and Mayor Suarez. They're both great leaders. They're on the front lines. Mm-hmm. They're living it every day. Both of them have personally suffered from COVID, and I'm sure they'll talk about that in a minute. So I'll leave the frontline details to them. I will say this. After having lived through Katrina, Rita, Ike, Gustav, the national recession, the BP oil spill, my mind takes me back to the comments from the folks on the World Health Organization panel where they basically said, we have the tools to win this fight. And they include command and control, coordination, collaboration, communication, and cooperation. And when we have those things, we can win. And when we don't, we're going to lose. And right now, none of those things are working particularly well, the least of which has to do with the federal government's cooperation with local governments. Mayor Suarez was basically saying that the reason he didn't get the money is because he's a couple of people short. There are 1,400 cities in America with 30,000 people or more in them. And if that money does not flow down to the mayors, and to the local governments, they can't pay the frontline workers. They can't pay police. They can't pay fire. They can't pay EMS. Those are the folks that are actually touching human beings that are actually being sick. So it's critically important that we change the way we're doing things, not the least of which to get this under control. There's another one coming. And oh, by the way, Miami just skirted a particular hurricane, which could have pushed us into an electrical outage problem or a food security problem. So it is essential that in the United States of America, the government officials, the private sector, the public sector, get our act together and start doing those basic things that we know are going to win. That's point one. Point two is this, and Keisha's exactly right about this. This is not something that's new. We saw this during Katrina. The water comes in and it hits everybody the same way, but it affects people in a very different way depending on where you are, what your station in life is, what kind of institutional wealth, what kind of access to healthcare. And it is absolutely clear from the data that we know about, let's put an asterisk around that, that is disproportionately affecting people of color for all of the reasons that we know, because institutionally, we are not in a good place. And so what we have to do in order to continue to prove that point is to collect the data. And quite frankly, some states have decided not to collect the data the way we need to, so that when we look back on this moment, we can actually then begin to get better next time. And I think that is critically important. And finally, I would say this, the next big fight that we're going to have that we have got to get a handle on is when we get a vaccine, God willing, sooner rather than later, that vaccine is distributed in an equitable way around the world and in the United States of America. And to my knowledge, there's no protocol that's transparent that we can look at to determine that's going to get distributed equitably. And that's critically important going forward.
That's critically important. How do we make sure that happens? Does that responsibility rest with the federal government, Mayor? To what extent do mayors need to be on the front lines and reaching out and saying to the White House, this is what we need in order to make sure once we have a vaccine, it is distributed fairly and equitably? Well,
I think all the mayors in America are talking about this now. It's an issue that's not, again, preparation so that something bad doesn't happen is the first order of the day. And since this is coming our way, this is something that we have to get prepared for. That conversation is ripe for open, transparent discussion. And, you know, God willing, the President of the United States, whoever he is or she is at any particular point in time, will lead this effort, not only on behalf of the country, but on behalf of the world.
Mayor Bottoms, you hear Mayor Landrieu talk about coordination and cooperation, and it makes me think about the fact that Atlanta, Miami, these are two major hubs for travel, for commerce. To what extent are you all leaning on each other right now and communicating with each other right now as it relates to getting tests out to your communities, as it relates to getting good information out to your communities so that you can fight this virus together?
So I think our federal partners could learn a lot from mayors. It was quite some time before I even learned that Mayor Suarez belonged to another political party. That's how well we work together. And it is imperative that we do that on a national level. Just recently, Governor Cuomo sent some test kits to Atlanta and some other resources to assist us. That's the type of coordination that we have each and every day. I'm constantly texting and calling upon other mayors, former mayors, like Mayor Landrieu and others, because this was something that we didn't plan for. Cities plan for hurricanes. We plan for ice storms. We plan for large scale events. By and large, we weren't prepared for a pandemic. And so this has created a need for us to call upon one another, but also to step up in a way that I don't think any of us expected to have to do. And part of it has been even, as Mayor Suarez mentioned, the federal funding. As those negotiations were going on in Congress, I got a call from Mayor Steve Benjamin in South Carolina, and I believe it was Mayor Garcetti in Los Angeles, who said Atlanta is about to be left out. So we went into a mad scramble to get our most updated census numbers included so we could get over that 500,000 threshold. We're the only city in the state of Georgia that was able to pass that threshold. And given where we are with our disagreements with the governor and with the state, I cringe to think of what would have happened or could have happened had we not received that funding directly. And it's allowed us to do things to go a step further. Obviously, there's a need to deal with COVID directly, but we're now able to deal with hazard pay for our workers. We're able to expand Wi-Fi and do so many other things that are these byproducts of where we are with COVID, that so many cities, including Miami and I would venture to say New Orleans, haven't been able to access those funds to do that.
I want to have Mayor Suarez pick up, but can you very quickly update us on where the lawsuit stands with your governor since you raised the tensions that you have had with Governor Kemp?
Right now, we are in mediation. We are continuing mediation. The stakes have been elevated a bit as the governor has noticed that he potentially will call a special session of the legislature to come back in to deal with any number of issues, many of which could impact the city of Atlanta. But it's my hope that we can reach an agreement. We are still at a standstill as it relates to the mask mandate. The good thing is we both agree that masks save lives. It's just a question of whether or not we have the authority as cities to mandate that mask be worn, and we're still standing firm on that.
Okay, Mayor Suarez, let me have you pick up on this idea of coordination and cooperation, because Mayor Bottoms says she didn't even know you were a Republican. How important is it to be able to work with the other party to be able to bring a spirit of bipartisanship to addressing this crisis?
I think it's critical because I don't think this is a partisan crisis. A medical crisis like this, a health crisis, should not have any sort of a partisan approach to dealing with it. And I think sometimes I feel naive for saying that. Obviously, we are in a presidential election year, but the truth of the matter is that, as Mayor Lance Bottoms was saying, I speak to Mayor, as far as all the way in the West Coast, Mayor Garcetti, Mayor Breed, Mayor Johnson from Dallas, Mayor Adler from Austin, Mayor Walsh from Boston. I'm constantly speaking to all these mayors as we are making major decisions that affect our cities and their economies. We had to cancel large events very early on, in one called Ultra and another one, Calle Ocho Festival. And I spoke to Mayor Adler, who had South by Southwest, which was a huge event, and he had to make a similar decision. So we were, discussing that with each other. The stay-at-home order, I remember having conversations with Mayor Breed from San Francisco, because she was one of the first cities that implemented a stay-at-home order, and we were struggling with our attorneys, with our legal counsel, that wasn't sure whether we had the authority to implement a stay-at-home order. And we did implement a stay-at-home order, and we were the first city or second city in Dade County that did that, and we saw our numbers plummet immediately. So, this kind of coordination not only was helpful in making decisions, but it actually saved lives, in my opinion. And I think that's why it's so important that there be a nonpartisan vehicle and a nonpartisan conversation when you're talking about crises, right? And as Mayor Landrieu mentioned as well, we just had a hurricane, barely miss us. So on top of all of the issues that we're dealing with in the city, we had to prepare, and we are prepared for hurricane season, which begins now in August, but doesn't end until later on in the year.
And I want to, before we get to our next round of questions, I just want to remind everyone who's listening that there is going to be an audience Q&A. So if you are listening, if you have questions, which I'm sure there are a lot of them, please raise your hands, and I will try to get to as many as possible once I finish my questions. Mayor Bottoms and Mayor Suarez, you both were diagnosed with COVID. This is personal for both of you. You've both witnessed the impact that this virus can have on you personally and on your families. Talk about how that informs your leadership at this moment, and also talk about where we are in this fight. Are you concerned we're taking steps backwards as cases are surging, including in your cities? And Mayor Suarez, why don't you start?
I was not only did I get COVID, but I was the second person in all of Dade County in a county that has had over 120,000 cases now. I was case number 2. So it definitely set the stage for me because, well, other people were struggling to grapple with what this virus could mean for them and how it could affect their health. I was going through it. And what it actually highlighted 2 issues that maybe are issues that people may not realize were issues. The first issue that it highlighted for me was, how would I isolate? I mean, I'm the mayor of a city, and isolation, which is so critical to containing the virus, wasn't a real issue for me. I mean, my wife, I'm married, I have 2 young children. You know, was I going to leave the house? Was she going to leave the house? Where was she going to go? Where was I going to go? I couldn't go to a hotel because everyone knew that I was sick. So it was very, very difficult. And I realized that if I was having a difficult time isolating, how would someone who lives in a 1-bedroom apartment that's a family of 4 or family of 6, or a 2-bedroom apartment, how would they figure out how to isolate? So that's something that I work with the state to sort of overcome. I think the second thing that I realized, I was fairly asymptomatic. And I also realized the danger in what an early detection, if we don't detect this early, and we're not detecting this early enough, I can tell you that right now, because from symptom to diagnosis, it's on average in the state of Florida, 5 days. That's way too long to have any sort of effective contact tracing. So, one of the things I realized is if you're asymptomatic, you can infect dozens of people who may not even know it before. And by the way, the outcomes are different. And this is more anecdotal, but as I talk to people, I would see in a household 1 or 2 people that were asymptomatic, 1 person that was critically hospitalized, another person that maybe was hospitalized but not critical. So, within a household, you could see a variety of different outcomes. And so all of those things informed, my decision making early on and helped me guide the city through this crisis. But we have taken some very, very difficult steps that have obviously had a tremendous impact on our economy with the emphasis of protecting the health and safety of our residents. We're starting to see now some of the good byproducts of that. One of the things that we did implement is a mask in public rule, and we are enforcing that. And so I sympathize with Mayor Bottoms, because we were allowed to, as a municipality, implement our own rules that were strict or stricter than the county and the state to be able to get this virus under control.
Mayor Bottoms, and if you would, as you answer that question, there were reports overnight that Dr. Deborah Birx, in a call with officials in Atlanta and statewide as well, said that she was quite concerned about a number of different states, Atlanta being one of them, Georgia being one of them. Is that accurate? Did you get that warning from the White House? What can you tell us about that?
Well, it's not surprising to me, and I know that Dr. Birx had visited Georgia and had visited with our governor, and I would venture to say our numbers would be much higher had we not been as aggressive as we were in Atlanta. And even with as high as our numbers are in the state, we know that there is so much higher because people simply can't get tested. And it is the interesting thing with Mayor Suarez's diagnosis. We had just been together maybe 2 weeks before the U.S. Conference of Mayors meeting. I think that was probably the last time that I traveled. And then he tested positive. And I remember watching him on television, my heart just breaking for him, because I could look in his eyes and tell he didn't feel well, thinking, oh my God, I hope this never happens to my family. And sure enough, it did. And even this morning, I was talking to my husband, who went down for a nap at about 6 o'clock yesterday evening and woke back up this morning. And I asked him if he was okay. He said, this COVID is real. And he supposedly has recovered, but he still has some fatigue. He's still waking up with migraines every morning. So for me, it's been this reminder, while we think we're dealing with COVID in a moment, and by the grace of God, if you're able to get over it and the worst doesn't happen, it really is not over. And it's a reminder we have to be vigilant on what these long-term effects will be, and what we know anecdotally and what's been borne out with a lot of the data is that men are hit so much harder, it appears, than women, in addition to the ethnic and racial disparities that we're seeing.
And I know that you talk about testing. I mean, that's sort of the crux of it. We know that some governors are actually banding together to try to get a better testing strategy. Mayor Landrieu, Is that what needs to happen? I mean, there's been this
Yeah.
criticism that we don't have a national testing strategy yet.
Well, first of all, it's unbelievable that we don't. It's malfeasance. And just to take you back to the issue of cooperation and collaboration, I wasn't just talking about mayors. They do this all the time, every day. And we laugh about stealing ideas from each other because we're the laboratories of innovation and change, and we do that freely across party lines. But it also has to work the other way, from the White House to the governor to the mayor. And when those things are not working well, you have a problem. There are two huge holes and examples. One was the acquisition of PPP. When the governors of these states and the mayors were trying to procure PPP on their own and competing with each other in limited resources, driving the price up, and then not having that PPP available, that is just, it's almost unforgivable that we were in that situation. The same thing is happening with the lack of testing. Both Mayor Bottoms and Mayor Suarez, I mean, their stories about their personal struggle while they're trying to run cities is incredible, but it pales in comparison to what citizens are facing every day. And when you can't get a result of a test, if a test is taken on a Sunday and you don't get a result back to the next Monday, it is just completely ineffective and it doesn't matter. They have other countries that have tests that are quick turnarounds. And the fact that we don't have a testing regime is something that we have got to get our hands on. I would like to make a bigger point, though. When Mayor Suarez was talking about the hurricane and we were talking about local aid, the same first responders that have to now respond to that hurricane are the same first responders that Mayor Lance Bottoms and Mayor Suarez are allocating to COVID. Those are human beings. They're exhausted. They're tired. We have hurricanes coming. And guess what? There's potentially another round of this coming in years to come. So we have to get this system in place right now for what's coming later. Always these mayors know that when you're looking down, dealing with the tiger that's right in front of you, you always have to look up to think about what's coming next. And that's why we have to learn from our mistakes without recrimination, reorganize ourselves, refocus, as the folks from the World Health Organization said, and get ourselves ready on a worldwide level and a national level and a city level to fight the next fight that's coming our way and to win this one as well.
What a critical point, and how important to hear from Mayor Bottoms and Mayor Suarez on the personal battle that you both had. So thank you for sharing that. What's coming next is this discussion about what happens to our young people who are going back to school. And Mayor Bottoms, I know that at this point in time, Atlanta has decided to do 100% online learning. Why is that the right decision? Could we see that change in a few months?
So for all of the reasons that we talked about in terms of the health disparities, and the thing that I think it's important to always reemphasize, this is not just about our kids. It's about our cafeteria workers, bus drivers, our custodians, and our teachers. And even in my household, and I know this is a story with so many households, when my kids get out of school each day, it's my mother who's at home waiting to receive them. And so I absolutely think it was the right decision. But again, all of these things surrounding COVID that we have to be thoughtful about. I was speaking with Mayor Lightfoot this morning, and we were yesterday, we were talking about the need to still be able to provide space for kids whose parents have to go back to work with small children. So that's something that we'll have to think through on how we extend something to parents who don't have the benefit of being able to stay home with small kids. And so the short answer, it was the right decision. Atlanta Public Schools will be doing it for 9 weeks and then reevaluate, but we still have to make sure that our kids have technology, that they have access to internet connection. And these are things that the federal government certainly can assist us with. And again, going back to the need for funding throughout the nation so that municipalities can get this technology and make these arrangements for their communities, because it is just inexplicable and unacceptable to me that we are here at the beginning of the school year when last spring we had every opportunity to get on the other side of COVID and not be faced with these decisions.
Mayor Suarez, it's a difficult decision. The president says it's safe to go back to school, though, to actually be in the classrooms. Where are you with this decision in your city?
I agree with Mayor Lance Bottoms. I think it doesn't make sense on a multitude of levels to start in-person learning when they were supposed to, which was supposed to be August 24th. Our superintendent moved it back to August 31st, and he just recently announced that there will not be in-person learning until at least October 5th. And I agree with that decision. And the reason why is because for two reasons. The first is obviously our children and our parents, our children being the most vulnerable in our community. A large public school system, I think it's the fourth largest in the nation. We have 350,000 public school children, 40,000 teachers. Putting 400, when you're a city that's trying to contain this virus, if you put 400,000 more people into circulation, it makes it very, very difficult. We are finally plateauing and trying to get on the dissension side of the new case curve. Putting 400,000 people more into the system is not something that's going to help you with that. And then, of course, emotionally, imagine we had a summer camp where two kids got sick in two different summer camps, and a counselor got sick. We had to shut down our entire summer camp program. So you just saw what happened. I mean, imagine for a professional baseball team like the Miami Marlins that almost had their entire season canceled. That can happen in any school and will likely happen if we don't have a control of this virus before we start. And for us, we've identified as the threshold as 5% positive, but even at 5% positive, which is a very low a threshold of a percent positivity, there's still a possibility that starting school in person learning could create a super spreader event. And so that's something that we are concerned with. I'm concerned with, and we're working closely with our superintendent to get the right moment to have in-person learning. But I definitely agree with Mayor Lance Bottoms that you can't start the school year with in-person learning right now.
And I apologize if you hear that background noise. That is Marine One. That's the president leaving. He's going to Ohio today. So that's the noise that you hear in the background, if you can hear that. I do want to talk about the other pandemic. And as Nick Burns laid out at the top, I mean, we are dealing with multiple crises at the same time in this country. And a lot of people see the other pandemic as African-American men largely dying at the hands of police. Obviously, this really reached an inflection point in the wake of George Floyd's death. Mayor Bottoms, you spoke so personally and so passionately about what needed to happen in the wake of that. You talked about conversations you'd had with your own son. And we've seen these protests all across the country. And of course, we know that the late Congressman John Lewis felt so inspired by the protesters he saw, because he said that they came from different cultures, different backgrounds, different ages, races. This is multi-generational, and he really saw that as something that was worth feeling optimistic about. Where are we with that? How much progress has been made, and what more needs to be done in your assessment?
We've made a lot of progress in Atlanta, but with every step we take, it's really a reminder of how many more steps need to be taken. And we've done some work around our police reform work and gotten the input of our police officers along with our community advocates, which has been extremely important. But I think what's most important is that we not lose this moment. While we have the interest and input of the nation and this recognition that there's still a problem with race in this country, I think it's important that in the same way Congressman Lewis and so many others in the civil rights movement clearly articulated their grievances and what they saw as a satisfactory outcome, it's incumbent upon us to do that. And that's the challenge that I see as a mayor, and I see very personally. And my kids age and range, 18, 12, and 9-year-old twins. So because my son is 18, he's grown up in this age of unrest. So I've seen it go from fear and concern to the other end of anger and frustration. And unfortunately, at the point that it gets to the anger and frustration, it's very difficult for people to articulate what that point of satisfaction is. And so this is work in progress. And in the same way, Congressman Lewis never let up, and the civil rights movement was just that. It was a movement. It wasn't a moment. This is a movement that we are watching happen in real time. And in the same way, Congressman Lewis dedicated his every waking moment to making sure there was change in America. We had that opportunity before us. What struck me was his parting message to us in his essay that was published. And he said, if we don't exercise the right to vote, we will lose it. And that is the most important message that we can give to people in 2020. We have to turn out and vote so that this is more than a moment, that this is truly a movement.
Mayor Landrieu, how do we make sure this is more than a moment, as Mayor Bottoms says? And you obviously, part of your legacy is removing Confederate statues, the statue of Robert E. Lee, putting money into reforming your police department in New Orleans. How does the country make sure this is more than a moment?
Well, I think what Mayor Lance Bottoms just said was very eloquent and poignant. I would add to it generally this way. The most American idea that exists, the reason we exist as a country, is based on a simple idea that we all come to the table of democracy as equals. And the fact of the matter is that slavery was this nation's original sin. Racism continues to be its Achilles heel. And until we all, as Americans, understand that Black lives matter, that we see the full humanity of our African-American brothers and sisters, then we will continue to see the consequences of what it is that we're seeing now. And whether it's the death of George Floyd or the way police departments are working now, or the disparate impact that COVID is having on African-Americans, or all of the other statistics that reflect, for a whole bunch of reasons, that this country has been divided by design from the beginning, we will continue to see these outcomes. And you'll see it whether it's a national catastrophe or something else. And so as we move through the specific issue of police reform, there are very specific things that this country knows we need to do that are hard. Body cameras, use of force policies, reallocating funding to the front end for mental health services and substance abuse rather than the back end, making sure that communities really understand that everybody is equal and valuable. And then that needs to move into housing, and it needs to move into food, and it needs to move into education. It needs to move into all of the institutions that are designed in a way that have produced this inequitable result. And unless we do the deep dive and learn the lesson, we will continue either to repeat the mistakes of the past, or we will get to that better day that John Lewis, who, my God, is a saint, I loved him so much, and he was such a clarion call for us. And he's told us where we have to go. Now, just sometimes people don't want to do what we know we need to do in order to get to a better place. And we as a country have to really kind of double down, reorganize ourselves, and recommit to get to that more perfect union that we spoke about so often.
Mayor Suarez, it's impossible to talk about John Lewis without talking about voting, as Mayor Bottoms and Mayor Landrieu just alluded to. So as we approach the November election, as you have the president saying he thinks it's going to be a disaster because of mail-in voting, despite the fact that there's no evidence that fraud is connected to mail-in ballots. But how do you make sure people are able to vote and to do it safely and to make sure that their vote counts?
Well, I agree that mail-in voting is just as accessible and should be just as accessible, and it's not fraught with any large degree of fraud or anything of that nature. And I think that we're going to see a tremendously high turnout of mail-in voting. We're seeing that now in our August 18th primary, which we're having just in a few days. And so, that's something that I think we're going to see. And, I don't agree that it's going to be a catastrophe. I think that, you either understand that this is a phenomenon that people are not going to feel very comfortable standing in long polling lines because of COVID-19, and that, the majority of people should have the right and the access to be able to vote through other means. And I think that's something and we're seeing people not only mail in their ballots, but we're also seeing them actually hand deliver their ballots so that they're, they know that it gets there, and also they know that they don't have to be waiting in a line in a cumbersome situation where they put themselves at risk.
And I'm going to open this up to questions in just a minute, but if I don't ask about Vice President Biden's search for a running mate, I'll have to turn in my journalism cards. So, Mayor Bottoms, we know that you were among the names on the list of people he was looking at very seriously. So can you update us at all? Do you have any plans to meet with the Vice President this week?
I have no updates. I'll watch the evening news to get my updates.
Good answer, Keisha.
Yeah, very diplomatic answer. Do you think Vice President Biden would be helped by running with an African-American female running mate?
I I think that he needs a strong partner, and given where we are in America, that partner needs to be someone who can speak to the moment, and whether it be where we are with social unrest, criminal justice reform, and just the need to address the disparities in our communities. I think it's going to be extremely important for him to have that voice alongside him, because those are some of the most pressing issues facing our country right now. But I do know it's a very accomplished list of women, and I'm very proud to say that to represent the mayors on that list is quite an honor.
All right. Well, we appreciate all of your thoughts and insights. This has been so illuminating. It's such a critical inflection point for our country. We do have a number of people who have questions, so let me open it up to questions. The first one comes from R. Maxwell Bone, and there's a little delay, so let's just give it a minute.
Hello.
Hi there. Go ahead with your question.
Yes. Thank you very much. My question is mainly for Mayor Suarez and Mayor Bottoms. Both of you are in states where governors have gained national attention for opposing stay-at-home orders. And with the rising cases in both of your metropolitan areas, I'm curious if you could see a situation where an additional stay-at-home order may be necessary, and what you are looking at, be it hospital capacity, death rates, to determine if that will be needed and how you would go about it, given the situations with your governors. Thank you very much.
So part of the issue that I'm having with our governor right now is the fact that the city of Atlanta has gone back to phase 1 of our reopening order. Those are voluntary recommendations, but we had businesses calling upon us to create some guidelines, and our phase 1 is essentially a stay-at-home order. What I understand in talking with the leaders of some of our largest hospital groups in the city, we are at and beyond capacity in most of our hospitals. And part of the reason is because we're open up as if it's business as usual. So those normal things that send people into ERs, car accidents, for example, whereas when the rest of almost the entire country is at a stay-at-home order, we didn't have as many people out and about and on our roadways, et cetera. Where now everyone's out and about. So they're going into ERs with those normal everyday things on top of COVID, and it is stretching our hospital capacity beyond its limits right now.
Mayor Suarez, can you see another shutdown or stay-at-home order?
You know, I've said from the very first moment that a shutdown order is not something that you can discard. It's something that always has to be on the table, and it's a tool that you have in your toolbox, and it's a very effective tool. We know that it's effective. We have been able to, unlike my colleague, Mayor Lance Bottoms, we have been able to implement a mask in public rule. We have been able to enforce it. We have been able to shut down businesses that are not complying with distancing rules. The county has shut down indoor dining. We have a curfew that is strictly enforced of 10 p.m. right now. So we have a buffet of remediation measures that are actually working. Right now, our hospital system census is down about 25% from its peak. And even though some of the latest results that we've seen for the last 4 days are influenced by the fact that we had a hurricane and we had to shut down, the state and the county did shut down testing sites for a number of days. So we have to see what kind of a regression to the mean there will be. But I think for us, what we would be looking at is essentially our hospital's capacity to treat people. And right now, our hospital administrators have told us that they have sufficient capacity, that what we need to do is enforce the rules that we have on the books. And we're doing that, and we're doing it successfully, and we are seeing successful Delta. If that improvement doesn't continue or doesn't continue fast enough, then certainly a stay-at-home order is something that we can and should consider.
Mayor Bottoms, just to follow up with you, is that the benchmark you're looking at, whether your hospitals have enough capacity? I mean, would that be what would determine whether stricter steps were needed?
So there were a number of metrics, but that was part of it. Also, looking at the 14-day increase or decrease, as long as our ICU bed capacity. And again, because of the governor's state of emergency, he was very clear on what the limitations were as it relates to local municipalities. But thankfully, Atlanta is home to 26 Fortune 500 companies, the metro area. We've had many of those leaders at the table with us as we've made these decisions. So that's made it a bit easier because many of our large job centers still have not opened up their doors to non-essential employees. So that's made our lift a bit easier in the city.
Okay. And we have our next question from Stephen Shapiro. And we'll give him a second to get his video and audio going.
Thank you very much. I'm with Business Executives for National Security, and some of you may know the organization. We understand that national security begins at home. And with respect to that, we often dig down into the nitty-gritty of structures and processes for effective delivery of national security. And so with the three of you on this Zoom, I can't think of anybody better to ask the question, and this follows up on Mayor Landrieu's earlier remarks about cooperation and coordination, about the structures and processes that you have seen in place, or that as lessons learned you would envision would be necessary going forward to make effective response at the local level to crises like this. I'd like to start with Mayor Landrieu on this because I think he could be perhaps nicknamed Mr. Crisis. I don't think anybody has effectively managed more crises than perhaps some biblical figures, and he's a bit of my hero in this regard.
Thank you.
But the two of you, Mayor Bottoms and Suarez, you're as well effectively dealing with this new crisis. So you understand what we're looking for. We're interested in, do you use the Conference of Mayors? Is your interaction ad hoc? Should there be a different organization, a crisis organization where you can pull the chain and things happen? I put it to you. Thank you.
Well, first of all, thank you for that. We could all be forgiven for wondering when the locusts are coming. But, the fact is, bad things that happen, they're going to keep happening, and we need to get ready for them. So being prepared is the most important thing. You not only have to be prepared in a crisis situation, you have to be prepared for the day-to-day stuff. The bigger theme here is that our nation's foreign policy and our domestic policy are two sides of the same coin of our nation's security. And I am heartened to listen to a lot of foreign policy experts beginning to understand clearly that unless we get our act together back home, then it's going to be very hard to protect ourselves abroad, because the point is to protect people actually on the homeland. And if you have people that are not healthy and don't have access to health care, that don't have a job, that don't have a way to get there, and we can't have a great economy, it's going to be very hard for the United States to project even moral power or military power across the country. That's the big issue. The second one is whether or not the system design in America actually works. You could have a perfectly well-designed system and have a president that just doesn't want to listen to the science and cooperate with the mayors. That sounds very familiar right now. Our governors and mayors that are on different pages. I happen to think that both of these mayors are exactly right, because they're using their decisions based on science, and that their respective governors and the president are not. So that design system is right, but the way people are acting within that system does not work. Having said that, I think there clearly needs to be a little bit better of a reorganization of how we all work together, A, in crisis, and B, just in normal day-to-day operations. We can always be better at that. And I do think there's some system design changes that could make it better and work, but people have to be committed to the notion that working together is better than being separate and being apart.
And that was one of the topics we touched on. It's such a critical one. Mayor Suarez, do you want to just pick up on that? I mean, are there steps that you want to take or think can be taken so that there's better cooperation?
There are, and I think, there has to be more communication. The fact that the coronavirus task force has just communicated with Atlanta is probably too late. They should have, or I don't even know if they communicated with Atlanta. They may have communicated with the governor. They should be communicating with Atlanta. They should be communicating with us. They did communicate with the city. just about a week ago. But it should have happened earlier, I think. I think the guidance that we should have received, and frankly, I'm not here to criticize a particular organization or set of people, but I think we need to get very clear guidance on when we should open, when we should close, based on science. And I think what has happened, and I don't know what Mayor Lance Bottom's experience is, but mine has been, I've had to cobble together epidemiologists, biostatisticians, local epidemiologists and biostatisticians to analyze data that I've received to make decisions, as opposed to getting more concrete data. I think, the White House opening strategy was helpful because it did give some sort of a roadmap for opening, but what it didn't contemplate was, what if things didn't go according to plan? And we definitely saw that things did not go according to plan. And so there was no, okay, well, if there's a resurgence, then do this. And then now that you're in a resurgence, when is the point at which you implement these other remediation measures? When is the point at which you open up other sectors of the business? So I think the plan was assuming a continual decrease, right? 14 days of decreasing data, syndromic data, et cetera, and you go from phase 1 to phase 2, phase 3, as if it's just some linear progression. Well, it didn't quite work out that way. And so there wasn't well, if this happens, then this has to happen. And so I think we were all left with having to figure it all out. And I think that's something that and frankly, and I hate to say this because there's been so much human suffering and so much death with regard to COVID-19. But imagine if this were a virus that took the lives of 20 or 30% of the people that got infected, if this were that kind of a virus. We need to get a lot better if, as Mayor Landrieu sort of alluded, if the next virus that comes is a virus that takes 20, 30% of the people that it infects, I mean, you're going to be talking about casualties on a scale that this country has never seen. And if we don't get it together, we could see something like that. And by the way, that is a threat to national security, because if you're another country, an exterior country that is trying to figure out ways to disrupt the United States, I mean, the playbook has just been written for them. You introduce some sort of a foreign biological agent that can disrupt the economy, can disrupt the political system, can disrupt just about every aspect of our society. And so we really, really need to get better quickly. I look at it from a hurricane perspective. When you get hit with a category 1 hurricane, which is the lowest in intensity, oftentimes it's a wake-up call. And you realize that if you don't increase your preparation level, when that category 5 comes, you're going to be in big trouble.
Really important warning there. Let me just get in one more question. Michael, check in if we can, and then we're going to wrap after this.
Wow, thank you very much for taking my question. It's a great honor to be with Ambassador Nicholas Burns. I'm your junior at State in the service, so great honor, but also be honored to be with all of you. And thank you all for your service. And we are in very difficult, unforeseen times. I'm really wondering about testing and tracing. So I've gotten the impression that many governments and health facilities have the PCR tests they need, but the real challenge seems to be the supplies, the reagents, the swabs, and then also to process them. I forget if it was Mayor Suarez or if it was Mayor Landrieu who mentioned this before, but right, if the test results come back, I mean, even Bill Gates says, if the test results don't come back within 24 hours, it's not a useful result. I mean, exactly, because it's only a snapshot in time. So I guess what I'm wondering is that what it is? Is it the lab capacity, the fact that we don't have enough lab technicians with the training required? We don't have enough machines to do the tests. We don't have enough reagents and the swabs. And as we are ramping back, will we need even more tests than we have now? Should we be expecting to see a big shortfall? And how do we catch up then to be able to provide testing and results within 24 hours? And on tracing, I guess Virginia just started a tracing program. I heard that New York State, even with the help of Mayor Bloomberg, is having challenges. Is it a matter of manpower, hiring enough people? Do we have the IT infrastructure to handle all those calls? Thank you.
You want me to take a shot at that?
Yeah.
First of all, this is what the experts say we need to do in order to help ourselves. One, we have to wear masks. We have to wash our hands. We have to keep socially distanced. We have to stay out of big crowds, and we have to test and trace. That's the playbook. All right. In terms of execution, only the office of the presidency has the power to order people to do what needs to be done. Both of these mayors will confirm what I'm about to tell you, that when you're trying to create a strategy, you're only as strong as your weakest link. And if for some reason you say something should be done and you don't really worry about all of the logistics from way up here all the way down to the ground, and there are holes in between, what you say doesn't matter. So yeah, you can say we're doing a bunch of tests, but if you're only getting results in 7 days, you might as well not be testing at all. And there has to be a federal testing regime that's run out of the White House with a testing czar that gets all of these component parts in place and then has the funding to make that happen. Then the mayors can use their power to execute the application of those things, get them to the labs, get the results. And then if the funding is there, this is really important. If the funding is there and we have enough money for as many contact tracers as we need and the tests turn around quickly, then you can effectively have a testing regime. That's got to come directly out of the White House and the federal government in order to have the resources and the regimen to make that happen.
Wonderful. Go ahead, Mayor Suarez and Mayor Bottoms, each of you, and then we'll wrap up.
Yeah, I'll take a quick stab at this. So I would say that number one, the contact tracing programs in the U.S. have been a colossal failure and disaster. And that's through discussions that I've had with multiple elected officials throughout the United States. I really think part of the issue is we're going to have to go to some technological product that's going to help us do it with an opt-in feature. I've looked at the New York one. I'm looking at the one in Houston. Obviously, you talked about the one in Virginia. We're trying to design our own and make ours better every day. But everything that I've seen has indicated to me that with a call center, it's very, very difficult to do. And so I personally believe that you're going to have to go to some sort of an opt-in app that is only, you have to download when you get tested. And then you can only get your test results through there and a variety of different functions that an app like that can perform to adequately contact trace. In terms of testing, it's a function of lab time. It's a function of lack of reagent. So it's a variety of factors. We're supposedly getting two surge teams that are being sent, two surge labs that are being sent to Miami to reduce that time. But I think at the end of the day, what's going to require is there's now a 15-minute antigen test, which needs to be more ubiquitous, and we need to make sure that it's accurate. If it's accurate enough and ubiquitous enough, that could be a huge, huge help to opening up the economy safely. Right now, it's not as ubiquitous as it needs to be. We're using it in some of our testing sites right now, so we'll get a better sense over the next couple of weeks. But I do think that there are shortages. I don't think the country was prepared. In fairness, it's hard to envision a situation like this happening. But I think we now have no excuse going forward. Now that we've seen this happen, we have to be prepared going forward. And obviously, lab capacity is one big issue.
Mayor Bottoms, final thoughts to you?
Sure, and I'll sort of combine the last two questions. One, just in terms of how we are prepared. The biggest takeaway has been prepare for things that you normally wouldn't be prepared for. In Atlanta, by the grace of God, we had recently appointed a chief health officer to deal with our HIV and AIDS rates. But the reality is public health doesn't come under the purview of the city. It comes under the purview of the county. Had we not had our chief health officer in place, I don't know how we would have navigated and made sense of this pandemic. But then the other part, just in terms of supplies, that is a huge problem. And a doctor's wife shared with me just yesterday that they can't run the testing that needs to be run in one of the local hospitals because they don't have the swabs to run the testing. And in terms of timing of testing and test results, my family is classic textbook of the failure of COVID-19. We were tested took 8 days to get the results back. The date of that test, I had a child in my house who was asymptomatic. My husband and I were negative. When we tested the next week, because we still hadn't gotten those results back and my husband was very fatigued, at that point, all of us were positive, and I was considered a low positive, meaning I was either on the way up or the way down with infection. We are assuming I was on the way up, which means that my husband and I could have avoided exposure had we gotten those test results sooner. So there's so many failures with the national response to COVID-19, but I don't think any of us have the energy to focus on those failures. We have to continue to put our energy towards what we can control. And I think we've been doing a heck of a job across this country in doing that. And I just want to give a shout out to Mayor Landrieu, who was former president of the U.S. Conference of Mayors, and the leadership that Mayor Barnett has given or gave to us during this pandemic. Weekly calls with mayors across the country, getting real-time information and coordination on how to respond.
Well, this has been such a tremendous conversation, and Mayor Bottoms, I hope that your husband does continue to make a full recovery. We appreciate all of you speaking so personally and passionately, and for your leadership at this critical moment, and just for sharing your insights. We are all in this together, and I see Ambassador Burns. Thank you again to Aspen for hosting this really important conversation.
Thank you.
Kristen, thank you to NBC. And I want to say to Mayor Bottoms and Mayor Suarez, thank you for the example you set today. You were both bipartisan. You talked about the real problems you're experiencing. You know, we are seeing a deficit of leadership in the country, but not from a lot of our mayors and governors in both parties. And you made us proud today, and good luck to both of you in the major challenges ahead. And I just want to give a shout out to my friend, Mayor Mitch Landrieu. He made an important point that we cannot be effective overseas if we're not whole and integrated and united at home. And Mitch stands for that. He and I are going to be working on an article on that together. So thanks to all of you. And Kristen, thanks for your great moderation.
Thank you. Thank you for having me.
Ladies and gentlemen, we're going to take a break. We'll be back at 12:45 with former Governor of California, Jerry Brown, to talk about this tragic anniversary, the 75th anniversary of Hiroshima, back at 12:45. Thank you very much.